Hyperthyroidism, also called overactive thyroid, is when the thyroid gland makes more thyroid hormones than your body needs. Now, Dr. Youssef Saad, the head of Department of Surgical Sciences at UNAM, joins us to give us more details on this condition. Good morning, doctor. Thank you so much for being here this morning.
Good morning, Elago. Thank you for having me here today.
Doctor, having described what hyperthyroidism is that a sufficient description, or is there a better way to really just explain what it is?
No, I think you got it exactly. It's a hyperactivity of the gland, which is causing some symptomatic effect on the person.
Yeah. What do those symptoms look like?
First, let me tell the audience the thyroid gland is like a thermostat of the body. It is a gland which is controlling the body metabolic rate.
Okay.
So if the gland is normal, then the body metabolism is just neutral and adjusted. If the gland is malfunctioning, then that metabolism will be affected. So hyperthyroidism, which we are speaking about today, is a status where the gland is overactive, which will cause the metabolic rate of the person to become abnormally higher than normal. So basically, this person will become into a status where he is almost jogging or running or exercising while he is sitting still or asleep. So the symptoms will be that he will have the heart rate is becoming fast all the time, continuously. He will be sweaty, he will be warm. Because of that, he will not be having a good tolerance to warm weather. So he prefers always to be in a cold environment. Because of that increased metabolism, he eats quite well. He eats abnormally more than average. And in spite of that, he's losing weight. So some person who is eating too much and still losing weight. And yeah, so all the body activities and actions are going to be on the fastest side to say.
Yeah. Doctor, how is hyperthyroidism diagnosed? What are some of the typical tests and exams that one has to undergo?
There is a small blood test which is routinely available in all the clinics, state and private, which is spotting it on. And actually, it is recommended that even neonates, children who are born, we do a small blood test to discover if there is a congenital abnormality of the function of the thyroid.
Yeah.
So a blood test is a basic thing, apart from the clinical symptoms once person is suspected to have this abnormality of the function.
And once diagnosed with the abnormality, how is it treated? Is it treatable?
Yes, it is well treated. We start usually with a medical treatment. So there are some tablets, there are some medications, and the medications are adjustable to make sure that we bring down the excessive function to the normal range. And then if that condition persists, usually give the medication for a period, then we stop it. And then we try to see if the person metabolism is drifted back to normal range. If that is happening, then it's fine, we watch. If that is not happening on its own, there are some lines that we give some radioactive material. It's a capsule or a tablet which is calculated for the patient, which will try to burn part of the thyroid to try to bring the remaining part to the normal range. And then surgery remain a good option for cases which are not responding to medication and radioactive stuff.
What would you say, doctor, then are the long-term effects of this excessive functioning of the body?
Yeah, any excessive function of the thyroid is going to deplete the body, and we see some people are getting extremely fatigued and tired. All the function system of the body, like gastrointestinal system, is not functioning well. Even the normal activities, the brain activities. So we are putting the body under severe strain, and that can cause severe fatigue and exhaustion syndrome.
Yes. As we head towards wrapping up our conversation, doctor, perhaps just as a cautionary awareness, how can one prevent getting a condition such as this?
Most of the hyperthyroidism, there is nothing really one can do or cannot do. There are groups who are at higher risk. So females of older age, Families of genetic diseases of the thyroid are also at higher risk. People who have themselves or first relatives of what we call autoimmune disease. So some stuff like type 1 diabetes or skin conditions like vitiligo or rheumatoid arthritis, they are at higher risk of being exposed to this disease. But there is nothing really habitual or something like person can do or cannot do to avoid being hyperthyroid.
Mm-hmm. Is there anything else you'd like to add?
No, I want to say that a lot of people can have a suspicion to the condition if they just notice that they are unnecessarily feeling palpitation, the heart is beating fast, they are all the time sweaty, they are not sleeping well in the night, they feel like, you know, they are all the time flushed, the hands are sweaty, then they might suspect the condition, and it's preferably to go for a medical advice in that condition.
Well, thank you so much, Doctor, for educating us.
Thank you very much for having me here today.
All right.
Much appreciated.